anesthesia. With humans, when we go to the hospital for any kind of general procedure, they'll give us a needle with a sedative in there, which makes us really groggy, and then they'll induce us with another drug, which puts us in, that's when they count down from 10, and you make it to 5, and you can't remember anything more. And then they'll actually put you on gas anesthesia. With birds, often, especially for really quick procedures like this, you don't need to give the sedative or the induction agent. You just need to give simple gas, because they process it so quickly, it hits them very fast, and all of a sudden they just fall asleep. And eagles, there's two major kinds of gases that are used in veterinary medicine. There's isoflurane, which is used, used to be used in humans a lot, and now there's another one called sevoflurane, which again, there was a bottle purchased through your organization, which we are very grateful for. Sevoflurane has been found to be much more, well, it's not as caustic, I guess, to the birds. Sometimes birds, they don't like it as much, or they'll have heart palpitations, and eagles do much better on sevoflurane compared to the isoflurane. So with our eagles, we only use the sevo on these guys, and that's the one they use on human babies right now.
So is he going to build up a tolerance to this and need more, or?
No, there's never been any documented cases in any species that I'm aware of tolerance to a gas anesthesia.
Has there been cases where they've needed to go under the anesthesia as much as Buddy needs to, because he's pretty regular?
He's usually under once every 2 months. And,
but that's not typical.
It's I'm just trying to think. We have birds that go under 3 times a year for general other problems. We do have a red shouldered hawk, for example, outside right now that has a crack in its beak, which was a very similar issue to this. The growth plate was damaged, but it was damaged in a very localized location in the inside of his mouth. And so that one little spot on the growth plate was damaged, and so it has allowed this crack to develop right at the side. So we can't let that get too long, otherwise it will flake off and then it sacrifices the rest of the beak. So we trim that down, usually every 3 months or so, actually, with him. So we definitely have had other cases where we've had to consistently put them and knock them down for these kinds of procedures. There's also other cases that anything that's broken its wing, for example, after the initial surgery, we'll usually use gas anesthesia to knock the bird down for usually 2 to 3 times a week in order to develop or to give effective physical therapy. So we can really stretch that wing out, push on the elbow, push on the wrist in order to, because it can be a little bit painful when you're doing that. You haven't used your limit all for a long period of time, and all of a sudden you're asked to go and do this. That's painful. So we put them under gas anesthesia 2 or 3 times a week in order to really stretch that wing out, break down some of that callus material that's going on around the joints, and allow them to get full extension. And they can be doing that for 2 or 3 months. So with this fellow, it'll probably be once every 2 or 3 months for the rest of his life, though.
Yeah. After his initial surgery, he had a bleeding problem. Has he shown any more problems like that?
No, not whatsoever. No, I'll show you some pictures of, not the bleeding event, but similar, and you can understand why that may have happened. This was just another x-ray here of just of the head itself. You can see this large mass sticking off the side of the beak, and this sort of region right here. This should be all black, just like this, but it's not. So with the x-rays, we didn't know, because x-rays don't do soft tissue really well, we didn't know how much was affected inside the beak, and that's why we needed the MRI. And the good folks over at the Augusta Medical Hospital Center here allowed us to take the bird in there after hours, sneak him in, and we were able to. This is just a more recent one where it's all black all the way down. This is actually just a couple of weeks ago, but we still have the twist in there. Yeah. But this was the MRI, and we were able to sneak the bird into the MRI unit after hours with the help of Bob, the technician over here, who has been just wonderful. We usually bring a bird or two over to him once every year, essentially to find out information that we wouldn't be able to find out otherwise. And this was the surgery.
How much would an MRI machine cost?
$1 million plus.
The actual machine itself is probably $1.5 million. Yeah, and then probably a couple $100,000 a year for maintenance.
And a very smart tech.
And a very smart tech, exactly. Dedicated.
They don't have a smaller one.
It is small.
They don't have portable yet.
So there's actual blood that flows through the beak?
Absolutely, yeah. There's
I was
lots,
curious about
lots and lots of blood in there. So this was when we were just putting the bird asleep. Essentially, we were putting a tube into his mouth. This was a little piece of gauze that was tied around the back of his head, and we had sort of scraped away the area as much as we could. But you can see how the beak itself, this is normal. We have at the very tip here, it's nice and hard and smooth, and then you have this sort of region right here that's all kind of bubbly and it's not hard. And so we needed to essentially scrape that down, which is what's going on here in the second picture. We've taken away a large chunk of the pox lesion itself. We had to dig down to blood because we needed it to heal normally, and if you had left any of the bad or the scar tissue on top, you wouldn't get a good healing formation over it. We did find that it had indeed gone right into the sinus. We actually were able to dig out this hole, which essentially led into all the open cavities within the beak itself. But the beak, just like your fingernails, if you cut down too far on your fingernails, you hit the quick. There's a nerve that runs all the way through this entire beak. If you also go down too far, you hit blood. Same kind of deal. It's a very blood-filled structure. And so we had to essentially scrape this away in order to get down to normal tissue. And the next technique we had to do was actually put on something to straighten his beak. And these were little platinum discs, or chains actually, that were actually physically attached to the bottom beak here. And the idea behind that is that we were then playing with an acrylic to make a great big block that would go from the bottom beak right up the side of his head, and so it wouldn't allow the top beak to sort of move over, but sort of bumping against it and preventing it from keeping on going over there. So that was the idea behind that.
Was that the dentist that was called in?
And this was from all the surgery that you're seeing here was by Dr. Avery Bennett, who's a wonderful surgeon, small animal surgeon, but specializes in exotic animals currently at the University of Illinois. And
Yeah,
it was actually very, very recently, I was talking to Dr. Natalie Hall, who was also involved in this procedure. She's currently doing her residency down at the University of Florida, and is in zoo animal medicine. And she went in, and they were doing some kind of special surgery on an African antelope, and they needed somebody good. So they hauled in Dr. Avery Bennett from Illinois, and he came in, and Natalie went up to Dr. Bennett and tapped him on the shoulder and said, "Hey, I was on the front page of the newspaper with you in Virginia," as Natalie would. And he kind of looked at her for a second, and then it dawned on him what exactly was going on, and he was asking how the bird was doing, and I was very, very interested. And I've received a couple of emails from him since the surgery, and he's always been very interested. So, great guy, fantastic that he was able to donate his time to come in here to do that. So this was sort of the big plaque of acrylic that was put on the bottom beak. It's actually fairly light, it's not as heavy as it looks. And this was sort of more of that platinum chain that was put over the hole in the top beak that we found, and we then covered it over with another acrylic material in order to sort of smooth it off and allow the beak to heal underneath of it, and eventually that would pop right off afterwards. That was the plan.
Yeah.
This was on waking up, and we've got this great big, huge honking. And the thing is, if he opened his beak up, he could actually almost reach the top of that with his top beak once it was open. And so we could have actually gone a little bit higher, which seems amazing to me, but that's the case. But overnight, it ended up that he did have a bleed. And what was happening was some of the nerves, or not the nerves, but the blood vessels on the beak itself were actually going into the sinus, and then from there it spread to other sinuses within the beak, and then blood basically started coming out of the nose. It didn't come out of this actual beak structure. But in order to find where the bleeders were, we needed to pop off that cap that was over the top beak in order to go in there, apply pressure, and stop the bleeding from occurring. So that happened, and then within a couple of days the actual plate came off as well. So at that point we decided let's go to plan B, and that was managing him supportively and trying to Dremel the beak effectively until to assess essentially if the growth plate was affected or not, and whether it would grow straight again. This is not a beak. This is actually a cross section of a big toe on a bird. So this is sort of the hard material on the outside. This is the bone on the inside of the talon. And this is sort of the first toe bone over here, and these are some of the scales that you would see on the bottom, and the hard pad on the bottom here. And I just sort of put that in here because the growth plate is very similar to what the beak is, similar to the talons here.